Daily Detroit is brought to you by the community. Support our work at patreon.com/dailydetroit.
Hey, it's Jer from the Paris of the Midwest. This is your Daily Detroit. And your show on Wednesday, October 21st, 2020, well, it is busy today. Dr. Paul Thomas and technologist Tom Lawrence join me. There is a new MI COVID app for your phone. It's to help with contact tracing, something that experts say will help contain the spread of the coronavirus. Is this a good idea? How will this help? And is your privacy at stake? Plus, more and more restaurants are doing tents and domes for dining as the weather gets colder. How should you treat them? Then, a few things to know around town. There's a lot to do. Let's get started. As the state of Michigan crosses 150,000 confirmed COVID-19 cases and 7,000 deaths, well, it's time to take stock of what's going on. There's been some developments. We're going to do some deep dives on some specific topics. To help us through this, we're going to have Dr. Paul Thomas from Plum Health Direct Primary Care. Dr. Paul, welcome to Daily Detroit, sir.
Thanks for having me again. Great to be here.
And to the other virtual side of me, I have Tom Lawrence from Lawrence Systems so that we can get extremely nerdy. Tom, good to hear from you.
I'm ready to get nerdy.
Let's get nerdy together, folks. All right. The first thing that I think I want to talk about that I just think it's an important development, I want to dive in, there's been a lot of chatter around it on social media, is there's a new tracing app for Michigan. There's kind of a pilot around MSU and U of M where there have been some serious cases. The news on Tuesday was that Washtenaw had gone ahead and basically put together an anti-partying ordinance to try to keep some students in place because of the outbreaks. I wanted to dive into this app. Should people grab it? How does it work? All that kind of stuff. So first, let's talk about the medical side. How important is tracing, Dr. Paul, and how can an app help?
Well, contact tracing ideally is a part of a broader plan put together with other things like hand washing, face masks, and social campaigns to kind of normalize protective behavior. And in that context, it would work well to help people identify where they came into contact or where they could potentially come to a contact with somebody who has COVID-19. And so, you'd be looking at those outdoor gatherings, the backyard parties, the indoor gatherings, if you're talking about college kids having house parties, or the grocery store or the coffee shop. The contact tracing app, if everyone had it, and if everybody used it and bought into the system, would allow us to really identify those hot zones where the coronavirus is spread. And it would allow us as public health professionals to reach out to those potentially exposed and help them get the testing that they need and recommend that they isolate for that 10 to 14 day period to more or less stop the spread.
Well, and looking at the COVID Act Now dashboard, we could really use all the tracing help we could get. Our percentage of tracers that we need to get our arms around the virus right now, over the last couple of weeks, it's dipped down. We just have 12% of the tracers that we need. And this is important as our test rate is now solidly over 5%, our positive test rate, and our daily new cases is now like over 18, quickly approaching 20. I mean, we're definitely in wave status now.
Yeah, I really feel like we're in the second wave already, which is concerning because it's so early in the traditional flu season. So we're going to have a lot of people where it's difficult to differentiate influenza versus COVID-19. And it looks like this COVID wave right now that we're in is going to be bigger than what we experienced in April. And so far it's shaping up that way unless, we make some drastic changes and change our social behavior to reduce the spread of the virus.
All right, Tom, I'm going to pivot to you because, I see a lot of chatter around this app on social media and people are worried about privacy. That's a real thing. So you did a deep dive into how this came together. So first off, let's set the table. How did this app come together?
The challenge, as we understand it as technical people and the people in the sciences, the public health professionals, one of the things they need more than anything else is data. So this is where a couple of big companies you may have heard of, Apple and Google, they put a couple of their best and brightest teams on this and said, let's say how we as techies can help create data points to help public health professionals trace this and, get that data in the hands they need. And guess what everyone has? A smartphone. So there seems like an easy pivot to do this. I think what techie people always underestimate is the human behavior patterns. But let's start with the privacy, though. Good news is, and I'll reference, because I don't want to go too out of scope on this, but for those of you that want to deep dive into the cryptography and the methodologies used, Steve Gibson on episode 762 of a podcast called Security Now.
Great podcast, by the way, if you've never heard of, if you're a nerd, if you haven't heard of Security Now, it's a great show.
It's a great show. In episode 762, he dives into the real nuts and bolts of how that actually works. Now, the good news is, not only him, Bruce Schneier, other security professionals have all vetted this and have varying opinions, not on the privacy, but on the efficacy of the app. But as far as people who are concerned about privacy, it's actually a really clever system they came up with, but it does have a little bit of a flaw. That flaw is the fact that it's working off Bluetooth LE for low energy. This is the connectivity that allows your phone to not have to be on all the time, but able to talk to lots of Bluetooth devices. And the challenge becomes the person on the wall next to me. And I say that very specifically because we are in a suite here. And if someone on the other side of this wall, who I do not share an airspace with, because each one of the suites we're in at the strip mall have independent HVAC systems. So if they're sitting against the wall that I'm sitting at, my Bluetooth LE says I'm in contact with them. And if they test positive and hit the tracing app and test positive, now we have a false positive. That's the one downside about these apps is it's still proximity based, but I still think it's going to be better than nothing is kind of my opinion on it. So I think it's worth loading. I think it's at least some more data points, but it is, of course, runs a risk. And I'll defer back to our medical professional on the line here of how do you deal with some of that false data? Because we know it's going to occur, but isn't it better to have some data? Is at least the opinion I think I'm at right now.
Yeah, I think that your case is unique. I think a lot of the contact that people have isn't going to be through a wall of a suite where you have a separate HVAC area. So I think the data should be really good. And then this is the broader question is, do people trust Apple and Google and the government enough to want to download these apps and use these apps and have them on their phone? And I think that speaks to a broader issue. And one of the big problems with this presidency, the current administration, is that there's been a lot of damage done to public trust in public institutions. And I think you're asking a lot of people to take a leap where it might not have seemed like a bigger leap if you had, built up public trust in public institutions previously.
Yeah. If you rewind the tape, though, one of the things that's interesting is that in a lot of Asian countries, they used these apps. I'm thinking specifically South Korea. They use something similar to this. Now, South Korea's culture is very different than the United States culture around collectivism, wearing masks even when you're sick, just not even pre-pandemic, right? They just did that. These were the kinds of tools that helped them get their arms around this virus very, very quickly. But they also supported that with isolation support. So if you lived in a home with 4 or 5 people, the government would actually go ahead and give you an apartment to pull you away from your home so that you didn't infect the rest of your house.
Yeah, those are really progressive policies, and even providing people in the home with food so that they don't need to go out of their home to the grocery store and potentially infect other people. Those are the kind of progressive government policies that build trust with the community and that help people act as a collective. I think that's part of a big reason why countries like South Korea did so well, is because they had a coordinated response.
Well, and there's a clear concerted effort for community. And for us to do things that are polite for the community is sometimes challenging here in the United States. As we know, if you watch one channel or another, you may have 200%, 180 out of perspective views of things. And that's obviously creating the divide of, where'd you get that information from? Because I believe information should come from this site, not this site. And therefore, that whole, like you said, the government keeps breeding into mistrust, which is where the techie people just keep underestimating the human factor, which is what all of us techie people run into. Why wouldn't people use this? Oh, that's right. Bad leadership sometimes.
All right. So I'll ask you both, download this thing? Question mark?
I say yes, I have. And I'm a big privacy advocate, by the way. For anyone who follows me on Twitter or anything like that, I'm a huge person who really thinks privacy matters a lot, even in the digital age, even though as these social media companies do a lot to strip privacy and identify you, mostly for the purpose of selling you things. But this app doesn't have any of those underpinnings. Even though it does have Michigan on it, it is still the core of it. The hard part that was done was by that Google team, and it has been vetted by the cryptographers to not release privacy information, but actually do provide good help for medical professionals and good data points for them, as he pointed out. Because other than those edge cases I mentioned, for the most part, you're likely, if you bumped into a crowd or hung out with a bunch of people, it's likely to help give that contact tracing information or even get you a notice whether or not someone has a case that was, within a very close proximity to you. And that's concerning.
I would say yes as well, just because we've seen how terrible this virus can be when we act independently and we don't really think of others. And it's time for us all to buy in and start thinking of other people in our community and acting as a collective to stop the coronavirus.
Well, good to know. So let's go to the next thing. The other day, I was out picking up some food and I just noticed the number of places around town that have outdoor spaces, but they are definitely, kind of walled in. And I've seen a lot of posts on social media about this. I've gotten questions about it where there's kind of two things that have kind of evolved. One of them is this bubble concept where, say we were all in a pod, guys, we would go to dinner, but we would be in a little bubble that's kind of just us, that's heated in the middle of, say, their parking lot or on a patio or something. And then the other one is where people have enclosed their entire patio and done something where there's four walls that are limiting your airflow. And then other folks are doing pavilions where all the walls are open. I mean, what is our risk profile with this kind of thing? And I mean, I know people got to make money, but I also got to think about if you go to these places, how should you treat them?
Yeah, I think I can field this one. I was doing a little bit of reading from some public health officials in New Jersey, and they came out with a pretty good guideline, a pretty good recommendation. And they said, basically, if all of the walls are enclosed, so if you have a tent with four walls and it's heated and everyone's enclosed in that space, you can basically count that as an indoor space. What they recommend is having at least two walls open to allow for proper air circulation. And even with that proper air circulation, you should have proper physical distancing, about 6 to 10 feet. I really respect my neighboring businesses and their need to make money and keep moving forward. But the best practice would be to have at least two walls open so that you have proper air circulation through that tent. And then, if you're talking about having a pod, going to dinner with yourself, your significant other, maybe 2 or 4 other people, maybe up to 6 people, then renting out one of those little pods, like one of those little geodesic domes or whatever, would be a reasonable thing to do. That way you're isolated from everybody else, but also in an enclosed space with your pod of people.
Well, and statistically, isn't it kind of all about a risk budget? And kind of those statistics kind of come into your world a little bit, Tom, where it's like, I mean, there's a risk at everything that you do, right?
Yeah, we talk about that in cybersecurity. You're always mitigating risk. You can not really bring it down to zero, but you do everything you can to bring it as close to zero as possible. So I always think about that because, I wasn't big on going out to eat beforehand. So I've been avoiding those places and letting the scientists and letting other people be guinea pigs as well. Let's see how many infections come from this, because a lot of people seem to be, they're not risk averse. They're like, I don't think there's a risk. But obviously we know it's airborne. We know sharing those tight and close spaces, if you share it with someone who has it, that seems to be the best evidence that you get it. I mean, there's plenty of science around that. So it worries me if there's not a big recirculation of air or bringing in of fresh air. And of course, in Michigan, as things get colder, we don't bring in as much fresh air. So those spaces become, to me, I think they're probably where the flus come from anyways, like just in general, not just the current COVID situation, but any of the viruses that are airborne, that happens. It's like when you ever go to a conference and they call it the conference cough you have about a week later because a bunch of people were in a closed effort.
I think we've all had those.
Oh, yes. I know. There's so much germ spreading going on there, but when it's as high risk as COVID, when it's much more devastating than the annoying cold or minor cough I had, I really try to limit my risk on those. I feel as though I'm a healthy person in my 40s, but I'm still getting closer in age to where I think that's a big risk.
Oh, for sure. So looking at social media, and there's meme after meme about this, there's kind of like two paths, it seems, where people are going out to places and it almost looks like they're not even like paying attention to what's going on. and then people who are kind of like locked in. One of the things that health professionals last week talked about was they're seeing a lot of spread among families and people who know each other. And what are your views as we go into the holiday, and what are you two guys going to do? I know that for me, I've already kind of shared that I will not be at Thanksgiving or Christmas, unfortunately, because it just opens up too many vectors. And I feel like that this is going to be a hard choice for a lot of people for the holidays.
Yeah, it's definitely going to be difficult because there's that's why we have holidays to come together as families and spend time with one another. But unfortunately, we're living through a pandemic, and it's going to be the peak of the pandemic, in my opinion, if things continue as they're going right now during the Thanksgiving season and perhaps even into Christmas. And so these are going to be really difficult choices for families. Maybe you have a smaller gathering, you have your nuclear family, just your closest family members, and forego the larger family gatherings with like the 20, 30, 40 people. I would say if you're going to have a family gathering, try to keep it under 10 people would be ideal. And as you expand that guest list, it's going to get more and more risky.
Well, and I guess the last thing I would ask is, with these kind of spikes, do we think that we have another lockdown ahead of us? Or is it something that'll be a partial lockdown? Is this something we should think about?
You're seeing in Washtenaw County with the U of M students, those students at the University of Michigan, because of the recent outbreak and the big spike in cases there, those students are on a stay-at-home order. They can't leave their dorm rooms, I guess, unless they are going to eat or pick up groceries or do other essential things. So that's a really good potential. A lockdown could be enforced again. However, you're seeing this get challenged in the courts in the state of Michigan, and it's becoming a very politically difficult issue for the governor. So who knows? Your guess is as good as mine.
Yeah, I feel as though the rhetoric at the level it's increasing at, they're just going to protest more if there's lockdowns. You can look at the recent cases like the barber who's, I believe, not been in any trouble for opening it up, which...
Yeah, his charges were dropped.
Yeah, so that's going to set the path for you can't tell me what to do. And that's just going to be a challenge. So whether or not a lockdown order occurs versus people actually following it are going to be, something to watch. And you'll have plenty of news to report on.
Well, guys, thank you so much. I appreciate all your time. Tom Lawrence, Lawrence Systems, Dr. Paul Thomas, Plum Health Direct Primary Care. Appreciate you both.
Thank you.
Thanks so much for having me, Jer. Great to be here.
The sale of a large portion of the state fairgrounds was approved by a 6-2 vote of the Detroit City Council on Wednesday. The way is now clear for what will be the largest Amazon facility in the region, with $400 million in development and thousands of promised jobs. It will also almost assuredly mean that the historic Coliseum and other older state fairgrounds buildings will be demolished. The purchase price paid by the Sterling Group and the Hillwood Enterprises will be $9 million. It'll cover 142 acres, half of which will be the Amazon development. Critics blasted the deal for having no community benefits provisions, as well as the lack of a historic preservation aspect. Its expected construction will start soon to meet the aggressive timeline. My 2 cents? I think it's a shame that we've not been able to find some way to repurpose or reuse those buildings. In Detroit, we so often demolish things for new that turn out to be not that great. I personally think there's enough money sloshing around. If someone wanted to step up, it seems like with a little imagination, something awesome could be done. That said, since the city of Detroit's finances are so dependent on income tax revenues, they make up the largest portion of the municipal budget here, almost any deal that involves promised corporate job creation is going to be fast-tracked. Also interesting, the city usually gets more money from casino taxes than property taxes each year, and both of those are smaller than income tax revenues. Speaking of jobs and development, the revitalized FCA plant on the city's east side has hit a milestone, according to officials. They say out of the more than 2,600 workers hired so far, they are all Detroit residents. The plans call for 5,000 jobs. This is a pretty big change from previous projects where often companies have been paying fines instead of meeting goals for hiring city residents. And finally, up in Ferndale, there's water worries as a number of samples from their drinking water system have lead levels that exceed state standards. City officials say that it's not about the infrastructure, but individual properties. Testing has become more frequent and has had higher standards since the recent Flint water crisis. A number of communities in Southeast Michigan have ran into similar issues around this lately. And if you're in Ferndale yourself, the Oakland County Health Division is distributing free water filter kits to residents who qualify on October 28th from 3 to 6 p.m. at the Gary Kulik Community Center. Well, that's it for today's Daily Detroit. Thank you so much for listening. And also thanks to our new listeners who have been flooding in this week. You are all welcome, and thank you very much. If you've got feedback for the show, email me, jer@dailydetroit.com, or leave a voicemail, 313-789-3211. That's 313-789-3211. With that, I'm Jer Stays. Take care of each other, and we'll get through this together. Talk tomorrow.